Within the health space, there have been Asian health advocates calling for a national Asian health plan or policy or strategy for decades now. And I guess that's kind of testament to the fact that Asian people of different communities have been in Aotearoa for a really long time.
Back in the 80s, the Asian community was very small, predominantly Chinese. And as immigrants and as a child of immigrants, we were told to be silent because we need to fit in, it's kind of be invisible.
The needs of different Asian communities are not the same as like the Pākehā majority. The mental health of young people and older people have been highlighted as areas where Asian people are not doing well.
I think there are many different reasons why it would be difficult for a member of my family or a member of my community or an Asian person to even contemplate or consider seeking help through a mental health service or going to talking therapy. Perhaps the experience of intergenerational or historical trauma and racism. And I think that not acknowledging that means that we sort of continue to put the onus on Asian communities that they're not engaged or not interested. And I think that's, grossly unfair.
Asians have been viewed from the Western stereotype as a model minority. We're obedient, we're submissive, we're quiet, we're compliant. We don't rock the boat. In terms of mental health, the model minority perspective is that we are successful, we are fine. We have any problem.
Part of the contribution to the stereotype is the fact that we're homogenized as the Asian ethnicity group. There's such a lot of diversity in how we come to the country, at the level of socioeconomic privilege we have, where we end up living, and all of that can have an impact on our health and well-being, and there are other factors as well. We're not all doing the same. And secondly, I guess the model minority is kind of a long-standing racist stereotype that pits often Asian people against other racialized minoritized groups. So in New Zealand, it's often used as a way to divide Asian peoples from like Māori or Pacific peoples, to say like, this group's doing well, why can't you be more like this group? And it actually harms all of us and upholds white supremacy. So I actually think the model minority stereotype is really harmful but pervasive in health, and it stops people within the Asian grouping from getting the right level of support that they need, but also harms other groups as well. There is a bit of a stereotype that Asian people are doing well and they don't need anything extra, which is also quite a problematic framing, because providing the services that people need, regardless of their culture or other background, shouldn't be considered as extra, but as the standard.
I think that we need to look at mental health from an ecological perspective in terms of looking at what are the institutional and systemic barriers that come into play. What are the unjust and unfair systems that affect people's mental health.
Throughout my counselling training and exposure to Western psychology and approaches, modalities, it was very apparent that considerations are made for the dominant culture or for Pākehā or for white people.
Not being represented in this really vital service, health, means that there is a risk that no one is thinking about or planning for the specific issues or needs of Asian communities.
There's just not enough research, there's not enough funding to really cater to or begin to understand the needs of the Asian population. I think it's worth acknowledging that this sort of one-size-fits-all pan-ethnic label of Asian is problematic. Asian people, we're not a monolith. we see time and time again, both emotional and mental labour being put on the backs of Asian people, women of colour, in so many spaces, to do things for free or to do things out of the goodness of their hearts. And it can be exhausting being an Asian woman and trying to coexist within these white or Pākehā-centred structures and systems, agencies and services. It can become really tiring when you feel that you continuously are advocating for culturally responsive and safe spaces for the people who you represent.
Cultural competency is a framing that seems to be kind of being challenged more within healthcare. Cultural competency might look like having a knowledge of how different cultures are different and then treating people differently based on that knowledge of difference. Cultural safety is more about the power differential that can exist between a patient and a health professional, and the health professional kind of acknowledging that difference, working to ensure that the care that they provide is acceptable and appropriate for the patient, and the patient actually has the power to define whether that care is safe or not. Understanding difference, yes, but also understanding that when people enter the healthcare system, there are a lot of factors that make them feel small or powerless, and doing what we can as individual practitioners and then people kind of building the system to reverse that cycle.
I've sort of let go of this idea that the mental health system in Aotearoa has failed me or my family or my community, my culture, because it was never built for us. And it centres Western European ideas and ways of seeing and being in the world over Indigenous and I guess multicultural ways of being.